because your flow is heavy, then you want to sit in one corner and not able to do anything. You're in pain, you want to soldier through the pain and all that. There's no award for it. There's no award for it. It doesn't make any difference. It doesn't make the period shorter, it doesn't make it longer, it doesn't make it less eventful. If you have heavy flow, it's going to be heavy. If you have painful flow, it's going to be painful.
Hello, beautiful people. Before we begin, take a deep breath in through your nose and exhale gently through your mouth. Let your body soften, let your mind settle. You're safe here, you're home. Welcome to Our Body and Mind, a safe, open, and compassionate space where women's health meets real conversations that heal, blending expert insights with heartfelt stories. I'm your host, Dr. Tammy Lawson, aka Dr. Tammylicious. Yeah, we talk about the challenges, the science, and the silent struggles women face from puberty to menopause, from reproductive health to mental and emotional well being, and everything in between. Today's episode is titled Menstrual Pain and Flow, Myths and Realities, and we will be exploring premenstrual syndrome, cramps, heavy flow, mood swings, and the crucial signs that tell you it's time to seek medical help. We will also talk about some of the most common myths, taboos, and misconceptions surrounding menstruation in Nigeria. Whether you're a young listener or viewer trying to understand your changing body, a parent raising a daughter, or a teacher guiding your students, this episode was made with you in mind. Lean in, breathe, and stay with me. Joining me today is an incredible personality. Is Dr. Wuko Iko Ojo Samuel. He's a skilled physician and surgeon and an expert in reproductive health. He is the medical director and chief executive officer of GISD Hospital Limited, Abuja. He will bring medical perspective we need for a conversation as important as this. Dr. Samuel, as I call you, you're welcome
Thank you very
to Our
much.
Body and Mind.
Thank you very much. Thank you.
Okay, let's dive in. In our last episode, I mentioned that every woman has funny, beautiful, and awkward period stories, and I shared my own funny and embarrassing experiences. Today, I'll share a beautiful period memory, a moment that still warms my heart whenever I think about it. So during my early teenage years, menstruation was always a struggle. Each month brought terrible cramps, vomiting, weakness, and loss of appetite. Painkillers only offered relief for a short time, but amid all that pain, there was a gentle, tender part that made the experience beautiful. My dad, God rest his soul. Yes, God rest his soul. Was more concerned than my mom. I used to tease her that she was secretly jealous. He would pamper me endlessly. Each month, he would ask, "What would you like to eat?" And every time I would say bole and fish, roasted fish, my absolute favorite. Without hesitation, he would have it ordered and served hot. No matter how bad the cramps were, I never lost my craving for that meal. Somehow, it made the pain feel lighter, even if just for a moment. Those were the moments I felt truly loved. And honestly, some days I wish they wouldn't end. The rest of the household might feel like a military zone, but during those times, I felt safe, seen, and heard. Now, when I look back, I smiled with gratitude. It reminds me that even within pain, love can create something beautiful. But not every girl is that lucky. Some girls miss school monthly, some faint, some end in the hospital, some can't stand or eat. And because society keeps saying it's normal, they think they must suffer in silence. So let's break that silence. Dr. Sam, you would help us understand why some girls experience menstrual pain, sometimes even before the period starts. I think that's what you call premenstrual syndrome. There's
Yeah.
also ovulation pain, right? And it comes with different challenges. So, why do some girls experience these challenges? Why do some girls experience pain and others barely feel anything?
Good afternoon once more. Thank you very much for having me on your show today.
You're welcome.
I'll try my possible best to break it down to layman understanding for us. So, we'll start with PMS, as it's called, premenstrual syndrome. So, let's start from the word syndrome. Syndrome means a collection of signs and symptoms like to make up a syndrome. So, premenstrual syndrome, as we say very often, are symptoms women experience before their monthly flow. Now, it's range from physical symptoms to emotional symptoms, psychologically. So, range from mood swings, physical pain, behavior changes, acne, and whatnot. Now, uh, every person differs from the other based on genetics, a factor of your environment, a factor of what you consume, and all of that. So, while some are very fortunate, others are unfortunate.
Ah,
So, you have a spectrum. There are people who are on the edge of the spectrum, people who have very terrible premenstrual syndromes, people who have little to nothing, and you have people who are in the middle of the spectrum, which we see almost every other person experience. So yeah, premenstrual symptoms or syndrome rather are normal, are normal. They are normal, and it's just a thing of luck. Some persons are fortunate not to experience severe pain, even while they experience a menstrual flow. It's not severe, almost non-existent, while some other persons are not that fortunate. Ovulation pain, however, uh, is usually mid-cycle.
okay.
Mid-cycle, it has to do with the release of follicles to mark ovulation. Yeah, so some persons just feel just sharp pain and that's all for them. Some other persons pain is excruciating and typically that lasts for a few hours to days and it's gone. Unlike PMS that could be on for days, ovulation pain is usually short lived, not so long before it goes. So yeah, basically.
Okay, so the menstrual pain.
The menstrual pain, for menstrual pain is normal, first of all.
Okay.
Menstrual pain is normal. Um, some other persons in spectrum that experience severe menstrual pain. Be a lot of factors that contribute to that. Factors such as endometriosis, people with fibroid, for example, instance, who experience very severe pain. People with adenomyosis also will experience very severe menstrual pain compared to the general population. So yeah, there's a form of pain that you would see and you know that okay, yeah, this is too bad. Now, some persons from the start or the word go of their menstrual flow, we call it menarche in medicine, from the first go, it's usually very painful. And they've lived that way all their life. Some of them were had adenomyosis for a very long time since the teenage years, and they feel that's normal as it ought to be. Some other persons start off their flow with not so severe pain, but as time goes on, they start to develop severe menstrual flow. There are other factors. Some persons who had menstrual pain after childbirth disappears. Some other persons after childbirth becomes worse. So these factors play a huge role in the outcomes of events for menstrual flow, menstrual pain in different individuals.
Okay. Thank you very much for that insight. I'll tell you another story. I didn't grow up in a boarding school. So the first time I ever lived with other girls, really lived with them, was in the university hostel. 2 sessions, just 2 sessions. But those 2 years felt like someone quietly pulled back a curtain and let me see the hidden side of womanhood that nobody really talks about. Because in that hostel, I began to understand that menstruation isn't the same story for every girl. Back then, my cycle was simple, light flow, for maybe 5 days, and I'm done. I didn't think too much of it. But every month, right beside me, I watched other girls fight battles that looked nothing like mine. I saw girls in the bathroom with blood gushing down their thighs. Girls who had to secure a pad right there before taking those few steps back to their rooms. Girls layering pads, double underwear, because one wasn't enough. Girls who avoided bright colors because things weren't an accident, they were almost a guarantee. And the pain. Some girls didn't just feel cramps, they suffered through them. Girls who missed lectures every month, girls who fainted, girls who were carried to the sick bay, girls who knew that every month their bodies would demand a hospital bed before class resumed. And even though my flow was light then, I wasn't spare the pain either. I had my own battles, but not on the scale I was witnessing. Then life moved forward. I became a mother. Everything shifted. After my first childbirth, my period disappeared for 9 months. But when it returned, it didn't come back gently. It came like a flood, heavy, relentless. 2 weeks at a stretch. Suddenly, I was the one wearing double pads, double underwear, monitoring every move, every outfit, every moment. After my second childbirth, the same thing happened. This time, 7 days of heaviness that felt like my body had forgotten its old rhythm. I remember one particular day, standing frustrated, overwhelmed, asking myself, why is my cycle like this now? What changed? Kilode. And then something happened. My mind traveled back to that hostel, back to those girls who had been living with heavy flow from the very beginning. Those girls who didn't have temporary changes like me, but permanent monthly battles. Those girls who pushed through school, life, expectations, shame, and pain every single month. And in that moment, something shifted inside me. I felt empathy, deep, humbling empathy and gratitude. Because even though my journey wasn't perfect, it made me understand the weight others carried silently for years. That memory, that reflection, it softened my frustration. It opened my heart. It reminded me that every woman's body has its own language, its own struggles, and its own story. So, Dr. Sam, hearing these different menstrual experiences from light and manageable
Mhm.
flow to heavy, long periods and debilitating pain, each of which has its medical terms, right?
Yeah,
Dysmenorrhea, amenorrhea, and all the menorias.
yeah.
What's really the cause?
As you rightly said, they all have medical terminologies for them, but I won't bore you with all of that. So, usually, the woman body, the woman's body is an interplay of hormones, lots of hormones. So you have a lot of hormonal interplay going on, and these hormones have a way of shaping the cycles, and during the cycles, five basic hormones have the surge and peak moments and affect the cycle. Now, apart from these hormonal factors, we also have some physical factors. Physical factors like body weight, people who are obese, people who are very skinny.
Mm.
You understand? I have that also.
Okay.
So you should have
Sorry to butt in. So when you're obese, there's a problem. When you're also,
too skinny. Yes,
there's a problem.
yes.
So where should we be?
In
In
the middle,
between.
in the middle. Yeah.
Okay.
So yeah. Um. So have other structural factors such as that's disease factors such as fibroid, adenomyosis, endometriosis. You know, these are other factors that affect the menstrual flow. Also, psychological factors, stress. Also, um, basically, these factors affect. So let's start with stress factors. Now, women would agree with me that months where the stress level is very high, sometimes you have delayed flow.
Yes.
It just the cycle doesn't your flow doesn't come as when expected. Shows that there's a factor to that. It affects the cycle. Also, when you lose so much weight,
Yes,
also
yes,
during that period, you
yes.
see that
I've
your flow
experienced that.
is also affected. When you add too much weight within a short period of time, also you see that it
Yes.
is affected. Now, you see cortisol's level builds up and affects these whole cyclical changes you see. Now, physical factors or structural factors, we call them disease factors. People with fibroid usually have heavy flows because the uterus fails to contract very well and leads to heavy flow for them, painful also. Same thing with adenomyosis, same thing with endometriosis, heavy flow. Now, adenomyosis, for example, we have deposition of a normal tissue, endometric, endometriotic tissues rather, in uh, other parts of the body, commonly in the bladder, and you see that during this period, the pain is something else. So most times people fail to know these symptoms and think they're normal. But then that's why it's very important for people to present to the hospital to make or lay their complaints so they can be well managed. So yeah, these factors and there's a genetic component to it also. Genetics, yeah. Some people genetically do not have long flow, do not have heavy flows.
Maybe.
So it's normal for them. So usually 3 days, some 4 days, some 5 days, some people bleed for up to 7 days. And that's what we ask when you started menstruating, how many days was the flow? Has there been any change in flow and all of that? And the weight gain and the weight loss? Are you going through psychological stress, emotional stress? We just want to know so we can know where to help and come in, basically. So yeah, that's for menstrual flow and menstrual pain. So yeah, menstrual pain is normal, like I said earlier on.
Yeah.
However, excruciating pain is not normal.
It's not normal.
So I'm an advocate that during menstrual flow, she take pain relief medications. There is nothing glorious about the pain. Doesn't make you a superwoman, doesn't make you a better woman, doesn't do anything. Just subjecting yourself to undue suffering. So it's not necessary. So you can take pain medications during that period and help. Some people in their first 2 days are usually very painful. So during those periods, by all means, take something.
But
Yeah,
Dr. Sam, there's a misconception about taking painkillers. So we'll talk about misconceptions later on. But some people just feel that we should not take painkillers. We should power through the pain. So we'll discuss that later. But I'd like us to stay more on the weight gain or weight loss as a factor that could affect heavy flow. You said we should stay in the middle, not too thin, not too big. But and then you talked about genetics. So you and I know that genetic is also responsible for some of us to be on the big side, and then some others to be on the other side. And of course, like women, pregnancy, weight gain, and then all the complications that come with pregnancy is also responsible or may be responsible for weight gain. So how do we manage such? Because some people genetically they are thin or slim, and then some other ladies genetically they are on the big side. So how do we marry the two?
Okay, now um, let me give some clarity to weight gain and weight loss as regards to menstrual flow. Um, they're not the major cause of heavy flow, but however, they will affect the cycle. Do you understand? When you have drastic weight loss, most times you don't experience heavy flow, you just have little flow that's spotting. You understand? So yeah, genetics as a factor in this would mean that some people are big and all of that. So, uh, like I said, the human body is dynamic. The human body is dynamic. So, if you've been a certain way for a while, doesn't mean because I was very big in my family doesn't mean we should be obese. No, you can work on diets, you can do exercise, and make sure that you're not obese. Now, because you have a craze or the current craze, I would say, to look like a model and you want to have drastic weight loss, it's very wrong. It affects the metabolism of the body. So weight loss is good, but it should be done systematically and gradually. So ideally, you should see a doctor before you embark on your weight loss journey, so he can guide you on what is right. You shouldn't lose 10 kg in just 2 weeks and start saying you are doing weight loss. It's going to affect your body basal
Okay.
metabolism rather. Obesity has become a public health concern in this town. And so it's we advise women not to be on the big side so much because it affects fertility also
Okay.
in this town. So yeah, and because we don't want you to be obese, neither do we want you to have a very low BMI also. Because if you do that also, it's going to affect the metabolism. So it's extreme of cases. But
Okay.
then be in the middle, have a good BMI. Understand 22, 24, understand your BMI, and just being within normal range. And this weight, ideal weight, differs for different people. So if you're very tall, we'll tell you the weight is supposed to be after calculating your BMI should be between this and that. You get if you are not so tall, we also get to calculate your BMI and tell you, okay, this is your ideal weight, basically. Now we'll do waist to hip ratio and all of that, just to be able to tell you where you're lacking and what you need to do. So yeah, so weight gain would not really cause heavy flow. It will cause reduced flow. Excessive weight gain, excessive weight loss will cause reduced flow. Listen, but then there are factors. If you are obese and you have fibroid, for example, you're not going to have reduced flow. You're going to have very
Everything.
heavy, painful menstrual flow. So that sometimes it might be refractory to common NSAIDs that you take. So yeah. So as time goes on, we'll still take these um cases in isolation and discuss them also so we'll have more light on that.
Okay, so moderation is the key.
Yeah,
Don't be too big, don't be too small. Be like me. Am I an ideal size?
we'll have to check.
All right. So you talked about some factors that could be responsible for heavy flow. You also mentioned factors responsible for painful period. So, as a mother or as a parent, caregiver, are there signs we should look out for in our girls, in our daughters, to point us to when to seek medical help?
Yeah, there are signs and
Okay.
symptoms. First of all, I would say a very good bond between parent and their girl child is very important. If your girl child comes to you and tells you that she's experienced a very bad pain this month, should be something you should take into consideration. complains about it again the second month that this my period is becoming something else, it's a cue for you to go and see a doctor. Don't say she's just exaggerating it, so to say. Yeah. Like I said, menstrual pain is normal. If you come into the room and you see her rolling on the ground from pillar to post because of, and you ask what's wrong with you, say, Mom, this is how I go through it every month. That is not normal. Menstrual pain refractory to pain relief medications is not normal. So if taking ibuprofen, if taking diclofenac, for example, and the pain is going to 100 still, that's not normal. So that's severe
Okay.
menstrual pain. Come in and she's in a pool of blood, so much so, that's not normal. There should be a cause for that. Now you be able to track the history of your child from when she started seeing her period. So you should know when at what age she saw her first period rather, and you should know the pattern that's been, you get. So she started seeing her period and it was very, very painful. And you know that this is not normal pain because you know as a mother you do not experience that. But sometimes because it could be genetical and
Genetic.
you feel that you also had something similar, but it is not supposed to be so. It's not supposed to be so. Every month she's in pain and crying for the first 4 or 5 days when the PMS is painful and everything about her is just pain. So 30 days out of a month, 15 days she's in pain. That's not normal. It's not normal. So you should
Okay.
seek medical counsel. If so, I said first of all, should be from the patient who is your daughter. Whatever she says, you should believe. Take her to the hospital. Let
Hospital.
it be that what she said she was over exaggerating it. Not that you just brush it. So I have a lot of young ladies who go through hell during the menstrual flow, and
Yes.
it's very painful. Most of them have had adenomyosis, and they've had it since they started seeing their flow. Until they come to the hospital and we're able to have some intervention for them, and they start to improve their quality of life. Some of them start to add weight, and look, you see people very skinny, and because they are bleeding everything out,
Mm.
and they're in so much pain. And when it comes to the hospital and they start getting intervention for these problems, everything changes. So yeah,
Beautiful. Okay, so you mentioned some girls having adenomyosis from the early age of 13. So there's the possibility of girls having these reproductive issues from this teenage age,
yeah,
like endometriosis, fibroid, or
okay,
what conditions could present themselves from the early age of 12, 13.
okay, yeah. So adenomyosis, for example, is the abnormal deposition of endometriotic tissue. Endometriotic tissues are tissues that's supposed to be in the inner lining of the womb. That's what causes it to bleed in instant during your flow. So yeah, so you now have those tissues deposited elsewhere in the body.
Okay.
So usually within the pelvic area. So most often times, it's seen in the bladder, and along that in the ovaries, and all of that. So when the menstrual pain comes, it's increased because what uh, endometrial tissue shouldn't be in the bladder, for example.
Mm.
And bladder is highly innervated. It gets a lot of
Nice.
nerves going to the bladder, so it's very painful. So the pain is excruciating. So no fault of theirs, they're born like that. You understand? They're born like that. So you could have, in very rare cases, you see spread. In some very rare cases, but most of these persons were born that way. So how do you get to know this? From investigation? You do an ultrasound, you see signs of adenomyosis in the bladder, and you put them on medication depending on the age of this person. Young ladies still within their reproductive age, you want to do some surgical procedure, or you want to do cystoscopy to see and visualize what it is and give best plan. Some persons, you just place them on pain relief medication and it eases the pain throughout that period for them. So when their cycle approaches pain relief medication, and it doesn't affect their reproductive life cycle. Now, same thing goes for polycystic ovarian syndrome (PCOS). They will not experience signs of PCOS at those teenage ages. Most times, you start to see symptoms from the ages of 24, 25. You get at those points in time, start seeing irregular cycles, you know, pain, see hirsutism, hair, facial hairs, and all of that at that point in time. So for PCOS, it's not something that comes from the word go. Over
Comes
time,
later in
later, yeah.
life.
For fibroid, it is a rarity to see teenage girls with
Okay.
fibroid.
Fibroid. Okay.
It's very rare, very rare. So I won't say it's impossible because you can't say impossible in medicine. There will be isolated cases, most likely. But I have not encountered any yet. So we would say for fibroid, it has to do with it comes from the peak of reproductive age from 24, 25, thereabouts. And your fibroids are normal tissue growth of it's like a tumor, benign tumor within the womb.
Yeah.
It's and that comes and go. And it's a problem of black people will say. It's an, yeah, it's common in blacks compared to Caucasians. In African Americans, you see them in Africa, and it's a common problem we encounter. So yeah, so you wouldn't see fibroid in teenage girls.
Girls.
It's
Okay.
very unlikely. It's like a tumor. You see big tummy and all of that. So you rarely see that.
Okay. Okay. Thank you for that insight. So we should be more concerned about endometriosis, adenomyosis in adolescent girls.
Yeah,
Okay. So earlier on, you mentioned painkillers and girls who experience debilitating pain should take painkillers. And I mentioned that some people have a perception about that. So let's talk about myths, taboos, and misconceptions. Remember your first period? I bet. When many of us saw our first period, the reaction wasn't welcome to womanhood. Nah, here's how to take care of yourself. It was usually panic. You thought you were dying. Your mom thought you were becoming a woman. Your teacher thought you had malaria. And your aunt, she handed you a wrapper and whispered, "Don't tell anybody. Don't touch this. Don't go there. Don't do that." If you're in Nigeria and you understand, we grew up in a culture where periods were treated like a secret mission, pads hidden like contraband, and you whisper, "Do you have a pad?" Like it's a top secret operation. My dear sister, it was like we joined the secret cult, but with cramps and no initiation ceremony. But why should a natural body function make us hide? Despite being natural, menstruation is often shrouded in silence in many Nigerian homes and schools. Girls grow up with fear, confusion, or shame because no one really talks about it. And that silence is what allows myths, taboos, and misconceptions to thrive. Before we dive deeper, let's clarify these three key terms: myths, taboos, and misconceptions. Myths are culturally held stories or beliefs that are false but widely accepted. Taboos are social restrictions, the don't do this rules, often tied to culture or religion. And misconceptions are wrong or incomplete ideas, those half truths that stick. By separating them, we can better understand what's wrong, why it matters, and how to change it. So, Dr. Sam, help us bust some common myths. So we'll start with the juju myth. It's really funny how some of us can believe certain things, but I understand. So there's this belief that when an evil man, in quotes, sees a used pad, I'm sorry, I said man. Okay, evil man or woman sees a used pad, he or she could use that for juju. Or if an evil man or woman knows a lady is menstruating, they could somehow use her blood for juju. So I don't know where that emanated from, but from a medical perspective, what's the truth?
Well, um, medicine is a science and also an art. Now, largely, most of our findings are usually science based, are objective, can be proven, and all of that. So, we do not believe in juju per se in medicine uh, because it's not backed, it's not proven scientifically. However, because of our environment, the space we find ourselves, we have religious beliefs due to our ethnicity also. So yeah, there become some norms in the society. Yeah, I do not believe that there's anything like juju because I'm a Christian. Uh, but then, if we say that things like that could happen, however, we advocate for proper disposal of sanitary pads, sanitary towels, tampons, and whatnot because it's unhygienic to just have them kept anyway. So yeah, I want to believe that most of those things were said to help the girl child adjust and do what is needed to keep the environment clean. Yeah.
Okay.
However, it is still not ideal for you to share your reproductive details with just anybody. It's not good for everybody to know that. Oh, some menstrual cycle, menstrual people. Now, talking from different perspective. Now, in Western world, you have cycle power to track people, just to impregnate them and do so many things, unspeakable things to people. Yeah, people want to have sex with women when they are menstruating and all of that, just to fulfill their own fantasies and all of that. So, from a security standpoint, also, it's not ideal for you to share your reproductive health with strangers. So, during those periods, should be disposed hygienically and proper hygiene should be taken and proper disposal of used parts also. So from medical standpoint, we do not believe in all those things in juju. Because most times when juju has come into play, the medical knowledge always wins. So we've not seen any display of that.
So there's no juju in medicine.
No juju in medicine.
Okay, so how about the myth that menstrual blood is dirty?
Okay. Menstrual blood is not dirty. Menstrual blood is not dirty. Yeah, it all boils down to hygiene also. Now if you go about during your day and you're menstruating and you don't put on a pad, it will drip down your thighs. It's not going to have a smell to it. However, when you put on a pad or you put on a tampon and blood collects there, blood has a smell. Now, because it's down there, other factors, bacteria is going to act on it, starts to get decomposed and all of that. So, yeah, you could have a smell to it. That's
Okay.
why we talk about knowing your flow days and how heavy your flows are, when to change your pad, and also maintain proper hygiene during this period. So yeah, menstrual flow is not menstrual blood rather is not
Not dirty.
it's not dirty blood.
Okay, so in our last episode, we discussed about menstrual hygiene, and a lot of these things were discussed.
That's good.
Yes. So another myth I would like you to bust is the belief that pads could cause infection
Okay.
or infertility, rather.
Uh, pads will not cause infection. Pads will not cause infertility. However, inappropriate use of pads could cause infection, cause sepsis. In case of tampons being forgotten inside the vagina, for example, you have sepsis. overwhelming sepsis, such as time care is not taken, you could lose lives from that.
Yeah.
Could have pelvic inflammatory disease from repeated uh, unhygienic use of pads. You wear one pad for the whole day, for example, and by the time it's coming off, it's smelling already. In the stand, those places, get that's that's unhygienic. So yeah, pads do not cause infertility. Pads do not cause infection.
Okay. Thank you. So let's talk about the sex myth. Some people believe that pleasure is highest during menstruation, and also the likelihood of pregnancy is lowest during menstruation. And many girls have been deceived by this myth. So, would I say they lure girls to have sex during menstruation because they believe that that period is safe?
Okay, now let's start with more pleasure during menstrual flow and all of that. So we'll talk about the mind being the highest or being the major pleasure center and major sex organ. So it has to do with thing of mind, fantasies and all of that. So yeah, for to each folk and to each person his own idealism or pleasure as it may be. So in some persons they might feel that way. You cannot dispute that. You can't say that is a lie, that you have more pleasure, you enjoy sex more during your menstrual flow. That's you. Some other persons may not. You
Okay.
understand? But to say that the likelihood of being pregnant, okay, is very low during menstrual flow. Ideally, it should be do so. However, there are people who ovulate when they're menstruating,
Okay.
who have an overlap of their cycle. Not very common, not very
Okay.
common, but there are a few persons like that. I've met a couple of people like that. When I'm trying to discuss infertility with them, I'll discover that okay, that's the case. When we start to track them, we'll see that okay, while they are menstruating, they ovulate. So for such people who they are desirous of conceiving or having a child, they'll have to have sex during their menstrual flow. Sex during menstrual period and all of that is not it's not a it's not a taboo one. It's not a taboo. It's between yourself and your
And
partner.
your partner.
Yeah,
Okay.
if something both of you want to do, by all means, say the sight of it is gory to some persons. Yeah, to have sex and see blood come out and all of that. So it depends on what both parties agree to.
Yes.
So it's more of a personal decision.
Okay. So based on preference.
Yeah.
Okay. All right. Thank you very much. I hope that we're changing our mindsets as we're listening or watching this. Okay, so let's talk about the food myth. Some people also believe that some foods cause menstrual pain. Like I know consumption of sugar, but the one of banana or pineapples or some other foods. I've heard people say that, but it's amazing to me that normal foods would increase menstrual pain.
Okay. Now, for this, I would say, okay, we cannot invalidate people's experiences from scientific point of view. We've not really not done any study to see what the correlation between taking sugary things, uh, products, or spicy products, or chocolates, and all of that, whatnot. We've not seen the correlation between that and painful menstrual cycle. However, we've heard lots of ladies say or pinpoint that as part of the reasons why they will experience very painful cycles or flows if they take sugary things. So yeah, from personal experience of these women who have come out to say this, I say okay, yeah, it's plausible. Yeah, but there's no scientific basis that I know. I've not done any research. I'm not aware of any research that's been done as to that currently. So yeah.
And personally, I take sugar, I eat anything and everything I feel like eating during my period, and it doesn't affect
Yeah.
my cycle. Yes, I usually have period pain, but there's really no difference considering my intake, right? So another myth I would like you to bust is the cold water myth. Drinking cold water or bathing cold water. Does it increase period pain?
No, it doesn't.
It doesn't, because I've not experienced that. I drink cold water, I bathe cold water, especially during the dry season. So, but for some other persons, I've heard people tell me, "Oh, why cold water? Take warm water or use hot water bottle to press and all that." Whether hot water, warm water, cold water, the pain is there, and at the appointed time, everything fizzes out. So there's no medical basis for that.
No, no, no. There's no basic basis for not taking cold water or taking having a cold bath. There's no correlation as far as I'm concerned, as far as I know. For symptomatic relief of pain during menstrual flow, use the hot water bottle. It has been seen to be helpful for
They
people.
will tell you take green tea or black tea,
All those
no
things,
beverages.
just marketing gimmicks
Strategy.
and all of that. It's nothing.
Okay, marketing strategy.
Yeah,
Okay.
there's no
Oh,
health benefits from taking green teas to make. No, no, no. It doesn't. It
okay.
doesn't. It's if you want to do it, do it. It becomes more of a psychological thing than
Yeah.
actual
Yes.
reality because
Over
when you
time, you
believe it,
become conditioned
to that,
to
yeah.
that.
So if you believe that it's going to work for you, it's going to work for you. And you believe that you take cold water in the morning and that's all for the pain. It might actually work that way because your mind, you may not see anything as pain anymore after taking the cold water. So it's your mind playing games on you, basically. But there's no correlation. You can't say don't take cold water. I mean, we're in Africa, the weather is very hot. So you
Yes.
said you want to take hot water during that period. It's just punishment.
Okay. So that brings us to the painkillers. Some people also believe that when a girl or a woman is experiencing painful menstruation, she should power through the pain. Our grandmother did that. Our great grandmother did that. She did that. So she also wants her daughter to power through the pain. Is it a myth or a
It's just
misconception?
sheer wickedness.
Okay, because personally, when I take painkillers, because I also experience painful periods, but when I take painkillers, it's just for a moment, and when the drug, the action of the drug is done, the pain comes back. So at some point, we just feel like, okay, this medicine is not working. Why not just power through this pain? All right. But then I want people to understand that if you wish to pull through the pain, that's your choice, but not a medical thing. So please help us clarify that.
So yeah, I said earlier on, menstrual pain is normal. However, because you're on your period, shouldn't affect your productivity. And because your flow is heavy, then you want to sit in one corner and not able to do anything. You're in pain. You want to soldier through the pain and all of that. There's no award for it. There's no award for it. It doesn't make any difference. It doesn't make the period shorter. It doesn't make it longer. It doesn't make it less eventful. If you have heavy flow, it's going to be heavy. If you have painful flow, it's going to be painful. So doing it over time, it has no benefit. It's no benefit. Why not take your pain medication so you can go about your day as though nothing is happening? And you take a pain medication will last for a period of time. So you know when it's supposed to elapse and you take your next dose and you go through your day, your flow and act normally. Nobody knows except for the times you need to go and change your pads and all of that. You should be able to go about your activity, except for the mood swings that you might have and all of that, which you cannot help. You get these other ones you can help. You cannot be battling mood swing and battling pain at the same
Pain.
time. You understand? That doesn't make
Double
sense.
wala.
Yeah, it doesn't make sense. Yeah.
Okay. So let's talk about childbirth. Does childbirth stop painful periods? Because I have two girls and the pain has not stopped. So I don't know. Maybe this is my experience. Have you come across ladies that have given birth and have not complained about painful periods?
Some persons who never used to experience menstrual pain after childbirth are experiencing menstrual pain. Some after the second childbirth, there's no hard and fast rule to it. Some persons, that's a reality. For some other persons, that is the opposite. Some persons after childbirth, the pain increases actually. Some other persons after childbirth, it starts to have a decline in the menstrual pain. So basically, depends on
On what the body wants. Okay, so after childbirth, if you still experience pain, take painkillers.
yes.
Okay, so going back to the painkillers, I wanted to find out or ask, is there any possibility that painkillers stop menstruation for a period of time? Because personally, I've experienced this. Sometimes when I take some painkillers on day one, my period stops till the next day. And then it also happened when I took moringa seeds. Someone introduced me to moringa seeds and said it's very good for menstrual pain. And I took a tiny seed, and the first day everything ceased till the second day. So is there a possibility that painkillers or some of these natural seeds or roots could stop flow?
It's possible. It's possible that you could have some adverse effect or side effects from that, from use of medications during your flu and all of that. But it's not a common thing. It's not common. I've prescribed pain medications for a lot of women, and I've not seen anyone comes complain that it stopped their cycle, stopped their flow. And so, but then it's possible it could react that way to moringa seed. I have no idea about all this. I'm not an herbalist, so I wouldn't know.
Okay, so yes, for the other painkillers, yes, I've heard few girls, yes, when I was in the hostel, I've heard in the university, I've heard few girls complain that they stopped taking painkillers because they noticed that once they do that on day one, it just stops everything, and it was like postponing the evil day for them. So they would rather, push through on day one and then just be done with it. But I think
I
it's
think
different for
for cases
different
like that,
persons.
for for such persons, what could be a factor is taking an overdose
Okay.
of the pain medication. So no, we do a lot of self medication.
Yes.
In yeah,
And you
in
just
this
want to
country,
kill the
pain.
pain.
Yeah,
Sharp, sharp, sharp.
we do a lot of self medication. You go to the hospital
Yes.
and say, okay, take 50 milligram of diclofenac. You say, this pain, 50 milligram will not do it. And you go and take 200 milligram.
Yeah,
You
that's a
understand? Yeah, so it's
possibility.
a possibility. So yeah, so if you take medications without seeing a doctor, you understand the adverse effect. Every drug has got adverse effects or side effects. You
Yes.
understand that possible side effects. So yeah, if you don't take the appropriate dose, you could experience some of those things. You could experience some of those things. Yeah.
Okay.
Same thing for herbal medications, like all of that. You don't even know the dose.
Yes. That's
Understand?
another
So
issue
you're just
with.
consuming a lot of things, and the, the poison is in the dose. So we say the poison is in the dose. Even paracetamol can be very harmful if you take a very high dose. So the poison is in the dose. So you don't know what you're taking. So actually, if you want to take medication for menstrual pains and all that, you should go to the hospital, see a doctor, prescribe, gives you a prescription on what to take and how to take them and when to take them, basically.
Okay. Thank you so much.
Okay.
We've talked about myths and taboos, and I think our culture and religion has a lot to play when it comes to what we believe and what we do not believe. But it is important that we have this medical perspective to know that medically this is normal, medically this is not normal. So the ball is in your court. You choose what you want to believe. All right? Okay. Because of cultural beliefs, girls are told don't cook, don't fetch water, don't enter places of worship, don't touch babies, and whatever you do, do not let anyone see your pad. Dr. Sam, you also talked about that girls should try as much as possible to hide their parts. So is that a taboo? Are you restricting us
No, 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 no.
or
Okay.
for our safety?
For safety, for the safety of the environment, proper waste disposal, because it comes waste. So you shouldn't come and see pad just everywhere.
Okay.
And that should be disposed carefully and
Okay.
appropriately,
Okay.
basically, yeah.
Okay, so that should be from a point of menstrual hygiene,
Yeah.
not fear,
No,
not
no, no, not
taboo,
fair,
not
not fair, not taboo. Yeah.
misconceptions. Okay, thank you. So these fears come from culture, not science. We all know our culture, but we must grow beyond harmful beliefs. Periods don't contaminate food, spirits, or blessings. A menstruating woman is not less worthy, less pure, or less spiritual. She's simply cycling, beautifully, biologically human. So, Dr. Sam, we've talked about beliefs, beliefs, beliefs. And, when you tell girls, do not do this, do not do this, do not do that, and then you tell them stories that do not have medical basis, you tend to put fear in them. I want to believe that it affects them emotionally, mentally, and maybe physically. So, can you address that aspect of the emotions of the girl child and mental state when parents, caregivers, elders in the community, leaders in worship places throw these myths, taboos, and misconceptions to girls?
Okay. So yeah, um, man is a social being, and we are a function of our society. Where we find ourselves, where we grow up, the culture, beliefs, and whatnot. So if you're born in a Christian home, you're most likely going to be a Christian. You're born in as a so if your parents were a far worshipper, so most likely going to be a far worshipper. Born as a Muslim, you're most likely going to be a Muslim. So we're all a product of where we find ourselves most times. So yeah, we have traditions based off of our ethnicity. If you're from Edo states, you do the Edo tradition. From Kogi states, from an Igbo man, an Igbo lady, you have traditions, and we respect our traditions. Now, I have no problem with traditions. I have no problem with cultures and beliefs of people, in as much as they are not medically harmful, they don't cause or pose any danger to humans or our existence. So yeah, sometimes some of these things that are said from these IOCs in depending on religion and ethnicity come from a place of ignorance. They come from a place of ignorance because if you say the do is menstruating is impure, it's not worthy of cooking. I mean, if you cook, what's going to happen? This is if you eat the food, are you going to die? Nothing. You get. However, because you wouldn't say, okay, yeah, you go to the Obas Palace in Benin, it's okay. No woman who's menstruating should go past so and so place in Obas Palace and all that. That comes from a cultural perspective. Not because I want to say, okay, yeah, I don't believe in this. I go to the Obas Palace and take ladies who are menstruating to go and cross the line. Let's see what's going to happen. No, you're looking for trouble. That's not being they're not speaking out. They're just causing unnecessary chaos and drama. That's different. You get now. Over time, culture evolve, practices have evolved, and what fuels this evolution is exposure. It's an exposure, knowing more, fact finding, and understanding that these things do not mean anything. That's what has helped to in the evolution of our culture and our traditions so far. So yeah, to parents, first of all, I think the onus is upon the parent, first of all, for the girl child. Both parties, the male and the female, the father and the mother, should be the first persons to educate their children about menstruation, menstrual health, and all of that. At each point in time, there are age appropriate sex education for the children. You don't wait until she sees her first period and she's in class and she doesn't know what to do. She runs out, goes to the tap or goes to the bathroom and locks herself up. And they start looking for her. Then she comes back and like, your mates have been menstruating. You cannot ask your mates. That's wrong. Something that also have been put in our subconscious gradually from the ages of 6, 7. Okay, sometimes women, as a woman, you grow up to become a woman, and every month you start to see a cycle. You flow. Sometimes it's painful. Some persons experience painful menstruation and whatnot. So when it happens to you, the first thing to do is tell your teacher, I just noticed this. Can I go and use up? Can I go and wash? Request for this and do that. When you do that, at first experience, it's not going to be very ugly. It's new to her. So do not add more confusion and panic to her. Teachers should also be aware of these things. Should be able to guide students under your care on what to do and what not to do. Basically, so schools should also teach sex education to let them know what is expected, such that the boys don't start making a mockery of a lady who is on her period because her first time I just stained her clothes, start laughing at this what's nonsense.
Yes, yes.
You get so all of those things will shape how the lady sees herself. Could become very timid during that period. She could be depressed during that period, and all of that. So it's very important. You need to do a lot of education and enlightenment campaign, like what we're doing currently, to be able to help them. So I also have a misconception that in the house, the mother should be the one to teach the girl child about
Yes,
menstruation and all
menstruation.
of that. Yeah, she, because of her experience, has more to say to the girl child. But the onus is also upon the father to also interact and make it a memorable, a good experience for the child. Because most ladies have a very strong bond with their
Bond with
father.
their fathers.
You understand? So yeah, she be able to chip in this, chip in that. Talk, okay, when you see this, go and meet your mom. Tell mom that so and so. In case you're alone, there's somebody around, this is what to do and what not to do. If you're in doubt, call me. I'll be there for you. And things like that.
Yes, you
Yeah,
reassure the
yeah,
child.
reassure. So give them that confidence that okay, it's normal. It's normal. It's a normal experience you should have. For religious leaders, I think all religious leaders should be educated.
Mm, mm, mm. Dr. Sam,
Yeah.
say it
It's
again,
not enough.
please.
All religious leaders should be educated. It's not enough that God called you. You should also go to school and have some form of education.
Okay.
Should be exposed, secondary school level minimum, that, so you can understand certain things. Certain things you hear from religious leaders because you like, where is this one coming from? Does not make sense. And either you like it or not, religious leaders have a very strong rule. They have a very strong reach over our people. An average African man or woman is religious, very
Yes.
religious. So even if you are a traditional ruler, I think you should be educated to an extent because what the traditional ruler says holds more weight than what the governor will say to
True.
the people. So you cannot have somebody at the epicenter like that spreading misinformation because he or she does not know better. So it's not coming from a place of wanting to do deliberate harm. You get, but then it's because he or she does not know what she's saying. Is that so? When we talk about ignorance, let's say share ignorance. So some people have half knowledge. Half knowledge is very dangerous,
Yes.
even more dangerous than ignorance, because you can say I don't even know. Let's talk to so and so, but that half knowledge is terrible.
Dr. Sam, you've gone to a place that will take us another hour to discuss. Religion, religion in this part of the world is very sensitive because, like you and I know that some of these myths or taboos are from the religious books. So, how do we respectfully break these myths without shaming culture or shaming religion?
Now, I give an example. I'm a Christian, and I say everybody should read your Bible, understand your Bible for yourself, and everything should be based off of that. I've read pastors say before that a woman who is menstruating is unclean. But I've never seen it in my Bible.
In the Old Testament.
They're not called unclean.
Okay.
They're not called unclean. They had special care what to be done for them during that period. And you should understand that these books were written in a time where some of these things we have today were not available. It would be an eyesore of a woman who is menstruating to be walking around the compound and blood be dripping down her body. So you should understand that it is contextual. So if you apply that, that means if you're on your period, you shouldn't go to church. But now, if you're on your period, you can go to church. Nobody knows that you're on your period. If you don't say, blood is not going to drip down your thighs. Do you understand? So, but then in those days, even our forefathers in Africa would tell you that when women were menstruating, they were kept in a separate hut, out of public eyes.
Mm.
There's a reason for that. Do you want her to walk around the compound and blood is gushing down?
Yeah.
She cannot go to the kitchen to go and cook food like that.
Okay, but now we have period products
Yeah,
that can collect the blood and
blood.
then you dispose of
Yeah, so
hygienically.
so as time has changed, we've also evolved. It's just talking about evolution. So but you don't see that anymore in the village saying that women must be kept so and so places when they are menstruating, you cannot go out. Now women go to offices. So would you say because she's menstruating, she should not go to office for 3 or 4 days? No, you can't say that. So if you go through this, you understand that some of these things, don't talk about being educated. Now, yeah, I'm an advocate that I belong to the school of thought that every pastor should go to school of theology because when you go for theological teachings, some of these things are taught.
Have you been there?
I have not been there, but I know people who have been there. I have an idea. I did little theology and all of that, but then I wasn't going to do it because I'm a pastor for inclusivity, just to know what they're being taught.
Okay.
As me, just for me to know, that people should, go to school of theology. We have pastors say that most people say they are called. If you are really called, go through every rudiment, go there. This time, you should have some form of education. Even no matter the religion sect you belong to. You've seen if you hear people, some scholars, Islamic scholars speak who are educated, there's a difference in what is said and what is not said. Understand? So it is very important because we have now evolved. Some things that we say and practice are out of date. They're not in tune with reality. It's just sheer wickedness. So it's not an issue of witchcraft or no witchcraft. And so education is very important. Because when if up to secondary school level of education, that's the basic. If you are educated from primary to secondary school, there are a lot of things that you would know. That's the basic of education. Whatever it is you're going to do in the tertiary level, you just to become a specialist to do whatever field you want to go into. You get, but then it shapes you. That's the basic education you need, basically. So these are factors that we've not really spoken about. We don't talk about. We don't debate. We don't explore because it has to do with religion. You
Dr.
understand?
Sam, we'll
So
bring
yeah,
you back on this show
well,
for
I'll be glad.
this medical versus religion versus cultural discussion.
Yeah, it's very important.
Yes,
I
because
think
it's
we'll
it's
discuss it
it's a
there.
sensitive one. We'll really have to discuss
No
that.
problem.
Yes. Thank you very much for this beautiful insight. I didn't know that the discussion would take this
Dimension.
yes,
I
this
also didn't think it
dimension,
was going to go that way. Anyways,
yes, this
but
dimension.
thank you.
But that's beautiful, and that's why we're here to break the silence. A lot of us cannot discuss these things in public, but I think it's high time we took the bull by the horn and begin to discuss these things. Like you said, exposure really matters. The world is evolving, so our minds too really, really needs to evolve. So as we wind down, Dr. Sam, what's one message you give to a teenage girl experiencing painful menstruation, heavy flow, and is just thinking to herself, why me? Just one message in a sentence.
To every young lady experiencing heavy flow, severe menstrual pain, I'll say speak up. Speak up. It's not die in silence. Speak up. There's hope for you. There's cure for your problem. This can be managed, very well managed, to improve the quality of your life by just speaking up. All you need to do is speak up, talk, see your doctor. And by all means, don't keep quiet. Just keep on talking until they bring you to the hospital, they see a doctor, and that's all.
All right. Thank you very much. So we need to break that silence. So about a year ago, I had a conversation with a woman who runs an NGO. We got talking about menstruation, and she told me about their project called Pad a Girl. She wanted me to support the initiative, and I remember jokingly saying, honestly, I might need support myself. Pads are so expensive these days. Even my domestic help uses the same brand I use, and she tends to waste them. I was just lamenting. Then she asked, what does she use? I said, sanitary pads, the ones I buy. She actually started menstruating while living in my house. And she exclaimed, ha, no wonder. She began her period in luxury. I was like, luxury? What do you mean? Then she said something that made my heart sink. She began to list what some other girls use: rags, tissue paper, hood cloth, even things I couldn't imagine. In that moment, I felt this deep ache inside me: empathy, sadness, disbelief. Yeah, I was joking about the cost of pads, while for so many girls, having just one pad is a privilege. I just said quietly, I'll support. Because truly, menstruation should never be a luxury. It's a natural, beautiful part of being a woman, not something that should bring pain, shame, or struggle simply because of poverty. And that conversation reminded me that sometimes awareness begins with empathy. And please, let's teach our sons too. Menstruation is not a woman's problem, it's a human reality. So, as we wrap up today's episode, I want you to pause for a moment and gently check in with yourself. What did you learn today that you wish you had known earlier? What belief or myth are you finally ready to unlearn? And what new truth are you embracing with confidence? Menstruation is not just a monthly event, it's a vital sign, a language your body speaks. And understanding your cycle is understanding yourself, your emotions, your energy, your cravings, your pain. They tell a story, and you deserve to know that story fully and without shame. If today's conversation stirred memories, brought clarity, or opened your eyes to something new, hold on to that. Please share it, teach it, and let it be a step toward a healthier, more empowered journey as a woman. Your body is not your enemy. Your cycle is not a burden. You are not alone. Take a deep breath and honor the amazing woman you are becoming. Dr. Sam, thank you so much for joining me on their Body and Mind show. And thank you for those powerful insights and for the dimension you drove us to. Thank you so much for coming on the show once
Thank
again.
you for having me. Pleasure is all mine.
Thank you.
Thank you.
Thank you for joining me on today's episode. If today's conversation brought you clarity, comfort, or courage, please subscribe. Share it with another woman, parent, or young girl who needs it. And if you would like to share your story, whether on paper, anonymously, live in the studio, or virtually, would love to hear from you. Just send us a message via our body and mind podcast at gmail.com. Make the most of today's episode. See the link in our bio to download the reflective journal, which has been carefully curated to support your journey. Stay empowered, stay informed, and embrace your body beautifully. And remember this, your body is wise, your mind is powerful, and your journey matters. Until next time, keep thriving.